Okay, so I guess where we should start is you reached out to me and I was like intrigued. Why don't you talk about how we connected and why you decided to reach out?
Well, first of all, I'm Tiffany, and when I reached out, I believe I was an addiction psychiatry fellow, but now I'm a public psychiatry fellow. So essentially, I'm in mental health. And that is kind of relevant just because mental health is like my passion. Not only do I have my own mental health issues in my personal life, but just in my work life, it's something that I feel is still stigmatized in this country, still not, treated the way that it should be treated. I went to residency in Louisiana, and for my fellowships, I moved to California. There was a lot of like loneliness and the pandemic and just a lot of factors that went into my mental health declining. I always knew that I had depression and anxiety, for which I was treated and put on medication. I was using all of these skills in regards to like cognitive behavioral therapy and trying to reframe things. And despite the fact that I was taking my medication, and despite the fact that, this is just my life in dealing with other people's mental health and trying to incorporate, basically, I'm giving a really, really long story to say that I was not doing well. And, so I stumbled upon Borderliner Notes, and I saw Charlotte, and that was like one of the things that really, really changed my life. And I know that sounds dramatic, but it's not, because when Charlotte was talking, it was like one of the first times where I was just like, that's me. That's me. Like, she gets it. She understands it. She gets it. And
can I ask you one?
Oh yeah, sure.
What was it about? Like, what part of it felt to you like that's me and she gets it, or she's helping me feel gotten?
She was really, really likable, and not to say like, oh, I think I'm so likable. It's just to say that for me, it made me realize that borderline truly is heterogeneous and has different presentations. So this whole time it was like, oh, I never even considered having that because I'm so high functioning. The people who were teaching me, my fellow classmates, like, we just didn't understand it. And so a part of the reason why I reached out to you is because I started watching Charlotte's videos. Like, I watched them like 3 or 4 times, and then I watched pretty much all your other videos, and then I went on other YouTube channels, and as much as it like satiated me in a certain way, it was like, you kind of very easily go through everything that's out there because it's different than other forms of mental health where like depression, anxiety, that can go on for days. But with like personality disorders, I feel like reputable sources of information are few and far between. And so I reached out to you just because I was hoping that through telling my story, maybe somebody who didn't as much so relate to Charlotte, maybe they relate more to me, and that's just how life works. And so I was just hoping that maybe I could help somebody the way that you helped me. So long answer.
Yeah, no, that's a cool impetus. And I also, it's like interesting to see how, when people have that impetus, how they apply it. And it's also interesting because it seems like your motivation to be in like the mental health field is so driven by the desire to help people. And I think that can sometimes get forgotten, as like a consumer of it. I sometimes actually don't really think about that when I'm seeing a therapist, even though of course I'm going for them to help me. But it doesn't necessarily occur to me that they're in this to help people,
right,
or I think they're in this, I think, for a number of people are in this for a number of reasons, of which that might be one or maybe primary. Do you think that most of the people that you work with who are treating people for mental health are in it to help people? Do you notice like a varied set of motivations with people?
So,
you're
like, not
training
to
with?
sound overly idealistic, but yes, I really do. I really have seen so many people who genuinely care. But with that being said, I've also seen the opposite. And so, like, I kind of feel like the Wizard of Oz, and like, I've kind of seen the man behind the curtain in that regard. And it's good though, because I know how much I care, and I know how much, colleagues of mine care. So I'm a huge believer that like finding a therapist or finding a provider is like dating, you know, and because we're all human beings. Like, we are literally all human beings. We all make mistakes. We all have just, you know, different personalities. And so in that sense, I think it's like the news is good. The news is good that there are good people out there. But at the same time, as we'll get into, like, I have had like chronic suicidal thoughts, and I have suffered with like depression and anxiety. And so I know whenever I'm at like a really low, there are times where it just feels like nobody can help, and not like, you know, and so while I said like, you know, finding a provider is like dating, it's also like, if you're feeling really shitty and just like bad, you're probably not going to go out on a date, right? And so you kind of, you don't just start exercising and eating right and doing all those things whenever you're sick. So it's like, if you're just in a really bad place and you interact with a provider, especially I know for me, with how much I can twist thoughts and stuff, a person may be a really decent provider, but just because I'm in a really bad place, my interpretation of it may make the experience seem bad. And so once again, that's why I think it's really important to like give people more than one shot, because that's actually kind of what happened with me and my current provider. I was a little bit like, oh man, like, what if she doesn't get me? Like, it was really scary, because it was like, I just wanted her to get me. And like, but I went back, and I'm still with her, and she has also, in addition to your videos, really helped me so much.
Wow, I keep wondering, like, for you, you know, someone like you who's sort of managed to get yourself through all of these very, you know, through medical school, you have a boyfriend. I mean, you have like the external trappings of like functionality, right, or success. So that isn't normally, I guess, a sort of profile, a BPD-ish profile,
Right.
So I'm just curious, you know, you talk about like having suicidal ideation, and I guess I'm like wondering, what are your BPD symptoms? Like,
Got you. Yeah.
so that's one question.
Okay.
And maybe we should start with that, and like, what have been your target behaviors, or your, you know, your avoidance behaviors?
Yeah.
You know, and how did you survive them to get through med school then? Yeah.
There was always kind of like that impulsivity. Like, I remember I would like spend money that like I didn't have. Like, I worked in the biology department, and like, rather than like try to save that money, I would be like, oh well, I want to buy clothes because it makes me feel pretty, and if I feel pretty, I feel worthy. And you know, like with like my boyfriend or with whatever, I was in a relationship, like a romantic relationship, and it was like very not good, like toxic abuse, all this stuff. And so like, there was definitely like impulsivity, there was definitely heavy like alcohol use to kind of like numb things out. There was definitely like the chronic emptiness, the chronic suicidal thoughts, like also the mood thing, like so easily. One thing could happen, like a person could look at me a certain way, and I'd be like, they hate me, I'm a loser, I'm a freak, and that would just cause me to spiral. So like, one little incident could cause my mood to change in such a way that my entire day is ruined. And then also, like, that caused me to feel like there was so much sense of like low self-worth, because like, it's for two reasons. Number one was that I thought that everybody had kind of the same emotional tumultuousness that I did. So I was like, wow, like, clearly I can't get a handle of myself. And then whenever I found out that people didn't have those like ups and downs, it allowed for me to have more compassion. Like, okay, like, no, that's, everybody is not holding down their emotions. And then also I just had like, whenever you hear of like borderline rage, like I always kind of had this like simmering anger, because like whenever you have that constant feeling of like worrying about if people like you or don't like you, then it inevitably causes you to alter your behavior because you want people to like you, but then you have this sense of resentment because you feel like you're not being authentic. The one thing that's good about like BPD is that you have an ability to empathize with other people, but that can be a bad thing when you overly empathize. So for instance, in that situation with like the toxic relationship, for me, I was like, okay, well, I've done bad stuff too, so like clearly like we deserve each other. Like he doesn't deserve me to abandon him because clearly I'm bad too. So it's like if other people would do like really like shitty things, I would never perceive it from the angle of me having to like take care of myself and protect myself. It would more so be like, how could I help this person to feel better? I would always take on so much responsibility for other people's feelings. Like, you know, my mom is like a really, really anxious person, and I think that that may be where I get some of my anxiety. But like, if she was upset or anxious, then I would feel like how can I make people happy? So like those are just like a lot of instances of where like my emotional instability, my lack of self-worth, my chronic sense of like, you know, just because in terms of like suicidal gestures, like I wasn't ever really much of a cutter, which is one of the other biggest messages that I want to send out to people, is just because you don't cut doesn't mean you're not like self-harming, you know?
Right. Well, and cutting isn't necessarily suicidality.
Right,
you know,
right,
like
right.
a suicidal gesture. It's just, it's like a, well, some people would, I guess, say it's an emotion regulation maneuver, you know. But anyway, go on. Yeah, sorry.
And also, Rebby, like, I just wanted to say, like, sincerely, like, I'm gonna probably say this a million times, but like, I just appreciate you so much, because it's just like, you know, it's obviously not like, I'm not like, oh wow, I feel so great telling people that like I, you know, have all these negative qualities, but like you and Charlotte make me feel brave. So that's my little side note. But yeah, so just those were kind of like really key features for me. And then that's the thing also, is that like for me, a lot of my behaviors would be very much so internalized. And so if you kind of like, if for other people who are familiar with your work and they can kind of like look at maybe like Regina, for instance, Regina was very much so open about how her issues were more externalized. And so I feel like when people have more externalized behavior, it allows for like other people to observe it. Whereas for me, I feel like I was able to go under the radar. But that doesn't mean that I didn't have pathology, you know?